Good afternoon, everyone, and welcome to this public listening session on living with chronic pain, perspectives from persons with lived experience. My name is Helen Burson. I'm the Executive Vice President and CEO of the Council of Medical Specialty Societies. Together with Deb Horry from the CDC, we co-lead the Pain Management Guidelines and Evidence Standards Working Group, part of the National Academy of Medicine's Action Collaborative on Countering the U.S. Opioid Epidemic, which organized this webinar. The listening session today will last about 120 minutes and will have the following structure. First, we'll begin by providing you some overview of the National Academy of Medicine's Action Collaborative and its work. Second, we'll then talk briefly about our Action Collaborative's working groups, focusing specifically on the objectives of our work group, the Pain Management Guidelines and Evidence Standards Working Group, including how the listening session today will inform our work. After the opening remarks, we will introduce the panel and move into the main part of today's program, which will consist of a guided discussion with persons with lived experience covering 5 key questions around pain management. These questions are also open to the audience for a written response. After the last question, we'll close out the session and share opportunities to engage with the Action Collaborative. We hope you will join the conversation on social media and tweet over the course of the webinar by using the hashtag Opioid Collaborative. I would also like to acknowledge and thank the sponsors of the National Academy of Medicine Action Collaborative who make our work possible. And with that, I'd like to kick the program off by providing a brief overview of the Action Collaborative and its work. The Action Collaborative is a public-private partnership of over 60 members from the public, private, and nonprofit sectors, all committed to developing, curating, and disseminating multi-sector solutions designed to reduce opioid misuse and improve outcomes for individuals, families, and communities affected by the opioid crisis. In order to enact upon its mission, all the work of the collaborative is designed with 3 goals in mind. 1, to identify and raise the visibility of complex challenges, outstanding research gaps, and needs of the opioid crisis that require a collective, multi-sectoral, public-private response. 2, elevate and accelerate evidence-based, multi-sectoral, and interprofessional solutions to improve outcomes for those affected by the opioid crisis. And 3rd, to catalyze action on shared priorities and solutions to help overcome the crisis and improve outcomes for all. The leadership, the steering committee, is co-chaired by the National Academy of Medicine, the Aspen Institute, the Department of Health and Human Services, and HCA Healthcare. We have 4 priorities of work, which each have a working group. First, health professional education and training, pain management guidelines and evidence standards, who is sponsoring this webinar, prevention, treatment, and recovery services, and finally, research, data, and metrics. The Action Collaborative's research working groups are organized around these 4 priorities as topical areas of focus. I'm now going to turn the presentation over to Dr. Mike Schlosser to introduce the Action Collaborative's Pain Management Working Group and today's listening session. Mike?
Great, thank you, Helen, and thanks everyone for being on the call. So my name is Michael Schlosser. I'm a Chief Medical Officer at our corporate offices with HCA Healthcare, where I oversee some of the clinical operations in our hospitals, and I also serve as Vice President for Clinical Excellence in our surgical service lines, and have particular interest in this topic as I'm also a neurosurgeon and practiced in the spine surgery space for a long time. So I'm a member of the Pain Management Guidelines and Evidence-Based Standards Working Group, which is one of the working groups Helen just talked about. This group is really looking to highlight and strengthen our clinical approaches to pain management, including patient-centered and evidence-based approaches, not just to the treatment of pain, but to tapering off of pain medications when appropriate, multidisciplinary pain management approaches in general, and then also we're particularly focused on kind of the implementation of pain management guidelines and the impact that has on those who are suffering with pain and being treated for that pain. So the working group has organized this listening session because we're particularly interested in the feedback from those living with chronic pain and who are treating their pain with various medications, as we want to understand both the intended and unintended consequences of some of the changes that have been made around how pain is managed, some of the regulations that have been put into place, also around the metrics that we use to track the management of pain, and what the impact of all of that is on kind of access and delivery and coordination of pain management services. So today's listening session will focus on the experience of persons living with chronic non-cancer related pain. We're going to be hearing feedback from them and their perspectives on those specific questions that were mentioned earlier. And one of the ways we're going to use this feedback, we think this is going to be really interesting, rich feedback, but one way that we'll use it is we're going to be creating a person-centered pain management journey map, which is really kind of a visualization of how folks with chronic pain kind of navigate through the healthcare system in getting that pain treated and all the different ways that that system is working or some potentially not working for them. And we think that journey map is really going to be illustrative and help clinicians and others kind of understand the way those patients are treated, which hopefully will inform better decision-making around how we manage pain inside of the opioid crisis. So we thank everyone for joining in our efforts to understand and improve pain management and care. As was mentioned, there will be opportunity for the audience to send in comments and questions in a written format, as well as through the social media platform. And we're excited about the interest and all the participation in the event today. So with that, I'm going to go ahead and turn this over to our moderator, Sarah, who's going to walk us through the structure of the presentation today.
Thank you, and welcome to the guided discussion portion of the program. Today's discussion will be about 1 hour and 40 minutes. Please note that the webinar is being recorded and will be available for access on the Action Collaborative's website. This listening session features a panel of persons with lived experience, and the discussion today will focus on their experiences living with chronic non-cancer pain, including their experiences interacting and navigating the health system. Due to time constraints, we will not be able to take live questions from the audience. However, there is an opportunity for audience to participate in the session by submitting their written responses to the discussion questions covered with today's panel. The link to this discussion question form is on the slide in this deck, and it can also be found in the reminder email you received today about today's event. And also it is on the NAM Opioid Action Collaborative website. Through the guided discussion today and the written responses from our audience, we hope to identify key information needed to inform solutions to existing practice and system level gaps in chronic pain management. Now I will introduce each of our 5 panelists, and then we will jump into our discussion. I will introduce our panelists today in the order in which they will be speaking. Our first panelist is Marianne Farrell. Marianne is a patient support group facilitator from the Pittsburgh area. She has lived with chronic pain for 35 years. Thank you for being here today, Marianne. Next, we have Kathy Cartwright. Kathy is from the Bay Area and believes in holistic care for the mind, body, and spirit. She has dealt with chronic pain for 21 years. Thank you, Kathy.
Thank you.
Next, we have Tom Morris. Tom is a retired lieutenant from the Air Force and now resides in California. He has been living with chronic pain for 32 years. We look forward to hearing from you today, Tom. Next is Penny Cohen. Penny is the founder and CEO of the American Chronic Pain Association. She has been living with chronic pain for 45 years. Our final panelist is Barbara Rossi. Barbara is a retired licensed vocational nurse and now spends her time as a happy grandmother. She has been living with chronic pain for the last 25 years. We are so grateful to each of our panelists today for taking the time to join us for the session. Each of you have a rich, diverse story that we are all looking forward to hearing about and learning from you. So thank you all.
You're welcome.
Now we will begin the moderated discussion portion of the agenda. As a reminder, the questions we'll be discussing are provided to the audience for their written submissions as a way to engage with and partake in this discussion. We will begin with question number 1. What aspects of your pain care are currently working well, and what aspects are not? Marianne, let's begin with you. As a reminder, you each have a full 4 minutes, and then we will move to the next panelist. Marianne?
Okay, thank you. Good afternoon, everyone. It's very nice to be with you here today. As was mentioned, I have been living with chronic pain for 35 years. I was in 2 automobile accidents, and the day after the first one, I began having a lot of lower back pain down my right leg, and it's only gotten worse. It's never stopped. I was given, after a long time, finally the diagnosis of having 2 herniated discs in my lower back, fibromyalgia, and TMJ. Right now, I feel the prescriptions that I have been taking for the past 10 years seem to be giving me the best relief for pain that I've had, which means that for the first 25 years of my pain life, I was so under-medicated for pain that I was really having a terrible time and suffering. Because I have many allergic responses to opioids, my doctors did try to give me them. I dutifully took them and tried them. Many of them were severe reactions. I also then had some opioid medications that caused me terrible side effects. So I couldn't even take any of those. I was under-medicated, as I said, and it takes a long time for a doctor and patient to come to the right prescription for them and for their needs. It doesn't happen overnight. I had to have a lot of patience, and I finally worked with my doctor, and we found an opioid that I could tolerate, and that's what I'm using even. Although medications are not the only things that one needs to manage chronic pain, I think they're kind of like almost a first-ditch effort before you can begin to function and do other things and try other modalities. Getting control of your pain seemed to me very important. Currently, as I said, my pain treatment is good. I have wonderful, compassionate doctors who understand what I've gone through over all these years, and they understand my day-to-day needs. I have a good rapport with my doctors. This always wasn't the case, though. Over these past 35 years, as you can imagine, I've seen many doctors who were not compassionate or understanding, and I soon realized that there's no way that I have to stick with that kind of a person. I fired them and walked away. And that's sometimes hard for people to do when they're desperate, as I was. Trying to start all over again with another physician can be daunting, but it can be done. And that's something that you maybe all need to think about doing as well. The big thing with a lot of doctors, because we look good, people who have chronic pain, we don't get the respect and we don't get the compassion that we need. I've been told by doctors, "You look fine." What do you mean you hurt all the time? And you know, it's very difficult to deal with that, but it can be done. So I just wanted to say that I finally, now I'm in a good place where I can have a more functioning life, do more things with my family and friends, and that was one of my goals. In the beginning, I didn't think that was ever going to be possible, but through perseverance and a loving family, I can't stress that enough too. When you're in this thing, you feel so isolated. Having a loving family surround you and good friends, that's what helped get me through all of this too. So thank you very much.
Thank you, Marianne. Kathy, you're next.
Yes, hi. This is Catherine Cartwright, and I want to thank you all so much for your patience this morning. All my electronics are going in the way they want to go now. They don't want to do the things the way I want them to do it. So I'm in the process of getting new electronics. For me, I started in pain in 1998. It was after my son had graduated undergrad. He and I had just did a little special slot for NBC, and we had filmed that, and then it was my birthday, and then at the end of October, I fell at work. I was doing groups, and I was on my way to my evening group, and when I went in the lunchroom to get some water, was other people there, and I just started slipping and sliding. And so when I fell, one part of my body went one way and the other part went another way. And I had bulging discs. Since I wasn't aware of the soft tissue stuff, I don't think I got the right treatment I needed to have early on. So, it took a while for those to heal. So I laid in my bed mostly for 7 years in chronic pain. I didn't want to take the medicines at first because I heard so many, horrible stories about taking opioids. And so I didn't. And finally, after I had an IDET, I don't know how many of you are familiar with that. They go in your spine and they have a heated, like a coil, and they try to go between your discs to have the nerves go through them to file the disc down. Anyway, it worked while I was taking the medicine, but as soon as I stopped taking the medicine post-surgery, it didn't work. So what I have tried and what is helping me now, and like I said, I didn't take medicine for 7 years, and I don't know why I let myself go through that, but I will never do that again in this life nor the next one. As soon as I started taking medicine for my pain, I was able to get to the gym and start the water class, which I started very slowly. And I wish I could do that again now, but I'll get to that a little bit further because I don't have money to pay for it. So that's a problem. But I just had radio frequency ablation about 3 months ago, and it's helping. It does help. Nothing completely gets me out of the plane. I don't know if I ever want to. I like to feel where I'm at always anyway. I'm in a mindful movement class. I exercise. Keeping warm helps me, and chiropractic services, and pacing my activities and using the American Chronic Pain Association tools has helped me a lot. They dropped my medicine strength, and they won't let me take my muscle relaxers anymore, which I was only taking like a fourth at a time. And in this cold weather, it really helped me a lot to be able to do that, to help my muscles relax, because I'm just like cramped up, all the time. And I do stretch 3 times a day. And I have arthritis, osteoarthritis, and fibromyalgia. And I take Lyrica for that. A lot of doctors don't agree with me. I only take it when I have a really bad flare-up. I don't take it every day. I'm not a person that likes to take medication. What's not working for me is that I can't go to the water class anymore. They will pay in the Silver Sneakers program through my insurance to go on the treadmill and those type of things, but a lot of those I can't use because they're too rough. I can go over railroad track and it will set me back. Still to this day, I didn't get a fusion. At the time I started being in pain, one of my best friends, she died in the midst of this. She had 3 back surgeries and a blood clot went to her brain. They took the first one out. Then when the second one went, she told her daughter just to let her go. So that was my first close friend to pass. Then I have another friend who had been dealing with chronic pain for a very long time. So she helps me a lot. But my medicines are not where I would like them to be, but I have to, do what I'm told to do, and that's what I do. And I'll get to that later on about the reduction of pain medication. Thank you for your time.
Thank you, Kathy. Tom, do you want to go next?
Thank you. Thank you, everyone, for joining in and for listening to this. I think it's important that everybody knows as much as they can about chronic pain and all its in and outs. I'm a retired lieutenant colonel from the Air Force, not a lieutenant, but that's all right. As I was introduced earlier, I had testicular cancer at the age of 35 while in the Air Force. I received too much radiation, so I have structural damage from the left hip to the pubic bone and up about a foot on the spine. Resulting from that, I now have every one of my discs is messed up. I have pain from my left big toe all the way up my leg, across the hips, both left and right now, and all the way up the back to my base of my skull. I've done just about everything when it comes to medication and therapies. When the Air Force tried unsuccessfully to help me for about 4 years, they medically retired me, so I started using civilian doctors. One of the first things we did was a pain management clinic where I was introduced to the American Chronic Pain Association. And I have to give kudos to the ACPA for not only their support, their recommendations, their program of peer-led support groups and education, but to thank Penny and everybody else, because it's really given me the, if you'll excuse the expression, the positivity to deal with chronic pain. I have, right now, I am holding my own. I live on epidurals with meditation, virtual reality, physical therapy, swimming, everything. I use everything to keep me going. And that's working really well. I mean, I did the 10 years on opioids, which I did not like because it robbed me of quality of life, which is what I've been fighting for since I started having pain. Trying to think where I was at. So one of the things with pain, you get brain fog. Right now I'm doing quite well. Every day is a battle. Every day is a different hurt. But I just keep trying. I'm not one to give up. The only thing I could say that is not working for me right now is looking down the road. Although I do a great deal of advocacy and I tend to look at studies of what's coming down the road, I personally don't know what's going to come down the road for me when my epidurals don't work, which everybody says will happen, but I keep putting it off. So my biggest problem is not knowing what the future has in mind for me, but I think that's probably what we all have. So with that, I'll close and let you move on. So thank you very much.
Thank you, Tom. Penny, would you like to go?
Sure. Good morning, everyone, and thank you for joining this webinar. It was a 6-year journey for me till I went through a pain management program. I actually went there to fail, believing there was nothing that could help me after trying absolutely everything that was out there for me over those 6 years. But what I had learned at the pain program it was that combination of skills. It was the listening to my body, pacing myself, not overdoing it. And it's so important to listen to your body when you feel that to begin to stop, knowing that it's time. I mean, that's so important for people. Also, reducing my stress and learning those relaxation techniques. And it's something that we have to learn. It's a learned skill. It's not something, that we just know automatically. Things like sleep and improving my sleep and stress reduction and staying active. But I think, we've heard about a number of people talking about the ACPA, and the reason I started that after I left the pain program, because I had so much fear, and I think that's the biggest factor for so many people is that I needed to maintain my wellness, because it was really in the end up to me to maintain my wellness. So for the last 40 years, I have been able to maintain my wellness because of all the continued support that I get from everybody else, but also that reinforcement that I can't just go out and tell people, you have to exercise, you have to eat right, you have to get right sleep and pace and listen to your body. It's because I got all that reinforcement that has allowed me to maintain my wellness and be a person rather than a patient. And that's something that is really important to me. Is, you know, I don't like to see myself as disabled, but rather as an able person to be able to do everything. So I'll stop right there.
Yeah. Well, my name is Barbara, and I have had fibromyalgia and psoriatic arthritis for about 25 years. What's working for me well right now was I got accepted into a pain care clinic located at a hospital near me, and they are working wonders with me. For my fibromyalgia, I have been placed on low-dose naltrexone, 4.5 milligrams nightly, which really helps with my sleep issues. I am also in a study at the hospital, trying to collect data regarding treatment of chronic pain with transcranial magnetic stimulation. And in my first experience, after 2 treatments, I never expected really anything. I began to get a lot of improvement in my back because I have very crippling arthritis in my back. They're just doing great things at that hospital in regards to pain care. I also use Enbrel for the arthritis, and that does help. The only drawback I have at this moment are the appointments are booked out months in advance at this pain care clinic. But other than that, I'm doing pretty good. I'm never really totally out of pain, but compared to what it was, it's almost like a miracle. And plus, getting off opioids after being on them for countless years gave me my life back, and I'm doing pretty well.
Barbara, let's move on to question 2. What successes and or challenges have you experienced in accessing and receiving pain care, including complementary non-opioid treatment options? Kathy, we'll start with you for this one.
Okay. Well, as I said earlier, I shared the things that I do that help manage my chronic pain, and of course, I'm never out of pain. One of the things in terms of me accessing treatment, I'm in an HMO, and I didn't mention that I have arthritis in one of my thumbs from using a grabber, and I still have to use it, but I had to use it every day for like 10 years without being able to, move in other ways. So as a result of that, I got the osteoarthritis, of course, in my spine and in my thumb. And so it's really deformed right now. And I do not want to get it fused. I don't, because it's my dominant hand. So I really don't want to do that. So I have asked to be sent to another outside person, but I can only go to people within my system. So I wanted to go like to UCSF in San Francisco, which I know is one of the greatest hospitals in the country, definitely the greatest in the state of California. It's above Stanford now, but they won't let me do that. So I'm just going around with a very deformed thumb. I stopped getting cortisone in my back because it stopped working. So that's why they gave me the radioactive ablation. So I don't quite know what to do with the thumb, but I'm just praying for something else to come along. I keep it in the brace. A lot of times I have to go get a new one. and I get cortisone every 3 months for it. And when I first got diagnosed with osteoarthritis, they'd never shared anything with me about what to expect. You know, everything I learned online, and I actually learned a lot from a conference I went to. They had never explained to me anything about osteoarthritis, and for a while I was falling all the time, you know. And I don't take a lot of medicine, so it wasn't over medication because the doctors see my prescriptions all the time. And so really, I don't get what I feel is good pain. All my doctors changed in the last year and a half. My primary care doctor, who I had for 28 years, then my pain management doc, who I had for about 12 years, and they all retired. So that's been very hard for me to start establishing relationships with people. My primary care doctor gives the medicine, and now it's really not a pain management doctor, it's a spine clinic doctor who, does other treatments. I would say that where really I needed the most help, and I got it, is from the ACPA, because they taught me how to have pain and still go on and have a life, that it's not, the pain is not me, I'm me. The pain is just part of what is going on in my life. But for me to master it, that helped me more than anything, because it's a certain amount of depression that goes on, And then they recently, within the last year, changed my medication. They took me from Narcan back down to Tramadol. And it doesn't, especially in the wintertime, it doesn't cover all the pain. And so, they took my muscle relaxers away from me and anything else that I was taking to supplement that. And I thought that was very cruel, the way they did that. I was in charge of doing a migraine seminar in Vallejo, and I was just, I did the best I could, but I was really in a bad state at that time because they just took me off the medicine. They didn't they didn't not wean me off, but taper me down. They just snatched it. They just took the medicine, and I didn't appreciate that. I thought that was very cruel, but I was able to still get through my life. We had the seminar anyway, but I felt that was not right. And from my experience in being a drug and alcohol counselor, we don't do that to patients. The doctors detox them down, So anyway, I have a pet peeve with that. And my primary care doctor doesn't know too much about pain management, but I just do what I do. I've never taken a lot of medicine. I never usually take my whole prescription before it's time to get it filled because I don't like to feel out of it. I just use it so the pain can be at a minimum, and so I can function. But what I really learned from ACPA has helped me the most, because it helped me with the emotional part and giving me tips on how to move and how to live life, and I really appreciate that. And the pacing for me is one of the main things. And doing the support group, when I started out doing the support group, I did it to help other people, which I still do, but it helped me a lot too, just to be around people that understand what you're going through, and we used all the tools from ACPA. So anyway, I had said earlier about the non-treatment things that I do. I don't think I have to go over that again, but I wish I could do massages. I can't afford that. I wish I could go to the water class, and I can't do that because I can't afford it and I have to pay for it. So only time I can get a massage is if someone gives me a gift certificate for that, which I greatly appreciate. So anyway, I have had some obstacles, definitely, because I'm in the HMO and they believe you have to fit in that mode, and if you don't, oh well, Thank you.
Thank you, Kathy. Tom, do you want to go next?
Sure. Over the 32 years that I've been dealing with chronic pain, I've seen the spectrum change when it comes down to what the doctors think and what the doctors can do and the basic knowledge of what chronic pain is. When I started out, the Air Force basically didn't know what chronic pain was. They kept throwing medications at me and until I got out of the Air Force, and I finally found a civilian doctor who started me on a path to getting in touch with what was really going on. That really has been the problem, to crystallize it. That the variant really do not have knowledge about chronic pain. Now that's increasing, slow process. I've had some success because of my faith, Marianne's, my wife's love, and her backing me up when I said this doctor is not doing what he needs to be doing. So I've learned to assert myself, and basically when a doctor doesn't know what he's talking about in my mind and he can't explain it to me, then I move on to a different doctor. That being able to assert myself has enabled me to find the right doctor that I can communicate with, to get him to understand what I'm feeling and then react to that feeling or that pain, and so he can explain what he wants to do to me. So we become a mutual cooperative society between the doctors and me, where a doctor doesn't do anything to me that he can't explain to me the pros and cons. There are a lot of challenges, but I have to say the successes have been because of personal perseverance. Doctors get too busy, don't have time. But if I had to list out the challenges, I would say the first one was a lack of support from the places of employment, whether it was the Air Force or civilians. A lack of understanding of the pain of what chronic pain is from the doctors. Too much stringent control on the medications, where because of the problems with scripts and what have you, I detox 4 or 5 times while on opioids just because the doctor did not do a prescription in a timely manner. I have to throw in that, you know, there is a lack of a cure. Nobody knows what chronic pain really is, and nobody knows how to get rid of it. That's a frustration more than a challenge. There's always a lack of information on chronic pain and the causes, and I know that's just because we're starting the investigation of chronic pain, but there's not a lot of information for patients, and it requires the patients to go out and find out information on their own. I also have problems with physicians not having time for an appointment to listen and communicate effectively. And I guess the last real challenge is having to feel that I have to prove that I hurt to an agency or the people. I mean, it would be great if we had a little sign on our forehead that says, I'm in chronic pain and this is how much I'm dealing with right now. But to sum it up, my victories are really due to my faith, the love from my wife, support of friends, my personality, and what I've learned from the American Chronic Pain Association. That's it.
Can you hear me? Okay,
yes, Penny, thank you.
Right, I was muted. I'm sorry. What I do remember from before I went to the pain program is one of the biggest problems, there were several of them. One of them was that, and I've heard this from other people, that because my pain was invisible, and you always make an effort to look as good as you can when you go out of the home, that they didn't believe my pain. It's invisible. They couldn't see it, and a lot of times, you know, tests will come back and they weren't what they expected, and they go, oh, you know, that's not what it is. And they tested me for so many, in those 6 years, they tested me for so much before they finally figured out what it was. And all I kept hearing was, I'm just going to have to learn to live with it. The problem is I didn't know how to do that. No one told me how to do that. I think the other thing is the expectation is that I think the healthcare providers, and myself included, is that we thought they could fix it, take it away. When in fact, when the truth and the reality of pain is, chronic pain is, it's something that you're going to have to learn to live with, but people can teach you how to do that. I mean, that's the point, that they have to teach you. Things like my physical therapy, they give me a couple sessions and that was it, but it was very passive physical therapy. One of the, I think the things that harm me the most is that every time I would say, you know, they'd ask, well, what did you do to make it worse? I'd tell them, and they'd say, well, don't do that anymore. And I think that was part of the problem, is they put this fear in me that if I did something and it made the pain worse, then I should not do it anymore. So you can only imagine after 6 years how deconditioned I became. And so when I went to the pain program, well, I think one of the things that they did for me is that they took away that fear. They did this really very long evaluation and came back to me and said, you can do what we're going to ask you to do. And it wasn't easy because it wasn't passive physical therapy. And so it was probably the hardest thing I've ever done in my life, and the pain did get a lot worse before it got better. But I think just learning how to use all of those, you know, complementary non-opioid options that were available to me, but someone had to teach me how to do it. You can't just tell someone to learn to live with pain. We have to actually teach them how to do that. And I had a wonderful opportunity going through a pain management interdiscipline. It was actually inpatient, where I could do that, both physically, emotionally, socially, the whole thing, because as other folks have said, that isolation when you're living with pain, people just sort of fall away. No one wants to be around you. And again, it's that invisibility of the pain. So I think validation of an individual living with pain is probably one of the most important things that we can do, and knowing that we have to be part of that treatment team. We cannot be a passive patient. We have to become an active participant. So thank you.
Thanks, Barbara. Or thanks, Penny. Let's move on to you, Barbara.
First, I have to reiterate what Penny just said. Validation of your pain is about the most important thing. Well, my story, like I said, started 25 years ago when hardly anything was known about fibromyalgia. Most of the doctors I visited with my pain issues said I had psychiatric problems. Most claimed it was all in my head, in quotations. Finally, I was diagnosed with psoriatic arthritis and fibromyalgia. The doctor who diagnosed me at that time said he could help me with the arthritis, but claimed I just had to live with the fibromyalgia. So I tried to find doctors for around 3 years who would even take me as a patient, because no one wanted to treat fibromyalgia. They didn't believe it existed. So after about 3 years, I finally found a doctor who believed my pain and started me on a 25 milligram patch of fentanyl. Well, I had about 12 years then of being able to resume my life, which to me was absolutely amazing. But then, of course, dosage had to be increased, and finally the opioids turned on me. In the last 10 years on opioids, my brain went dead. I had no emotions of any kind. I basically laid in bed for 10 years. The pain got to unbearable levels because it does that with opioids. I think the biggest success I've had in this journey was being treated at a hospital at a dual diagnosis clinic. I was treated there for drug addiction and depression. And then after 2 years of being treated there, was admitted for detox at a hospital, the same hospital. And that's where my journey back to being me finally began. But I want to reiterate something that Tom said. Opioids are not a wonderful choice, but for some people, they are needed. And I think they're being withheld right now by doctors out of fear. And I'm very disturbed by that. I think for short-term use, opioids are our only option right now for severe pain. But I say again, short-term use. And that's about all I have to say.
Thanks, Barbara. Let's move on to you, Marianne.
Hello. I guess maybe I'm one of the few people who have been taking opioids for 10 years with great success. I have no terrible side effects. I have no euphoria. I have no overtiredness from them. So I count myself as one of the lucky people. Back in 1985 or 86, physicians were giving out opioids like they were candy. Of course, now things are different, and that's probably a lot better. It was a monumental challenge for me to find some things that worked in the opioid department. I had a rhizotomy, which was like a semi-operation where they cut some of the nerves in my spine. And at first it worked really well, but then they all grew back. I also, of late, the past 5 years, had something called a spinal cord stimulator, which was supposed to give the person a feeling, a sensation that made the pain not so strong, and a lot of people get relief from them. Again, the spinal cord stimulator didn't work for me, but I'm glad I tried it. The one thing that the doctors kept saying to me in the beginning was, you have to go to a pain clinic. And I would go, and all they wanted to do for me at that point was to give me steroid lower spinal injections. These absolutely never, ever worked for me. But they insisted on doing at least 3 of them, and I would put up with it. Then finally, I would try a different pain clinic. And unfortunately, the results were the same. The doctors absolutely did not believe that they didn't work. I guess every doctor thought, she just wasn't giving them the correct way, so here we go, we're going to try them again. It just got so ridiculous that I quit going to pain clinics. But the thing that was mentioned by Penny, I know, and the thing that really saved me was going to a pain management clinic. And at the time I went, it was inpatient. 6 weeks of boot camp. Strenuous, and like her, I was told to do physical exercises, and it really got me out of bed, got me back on my feet. And so to this day, I still do stretching exercises, even when they hurt, because I know if I stop doing them, I'm going to hurt worse. The doctors, I should say, are not trying to wean me from my opioids like a lot of doctors are. I'm not on a huge dose of them, and I'm fortunate that I'm able to keep taking them. Many sources of complementary medicine have appealed to me over these past 35 years. Chiropractic treatment has given me good relief at times, but back 25 years or more ago, it wasn't covered by health insurance, like some people have it now and they can use it. I had to pay out of pocket. This was difficult for me because of my pain level. I had to give up my teaching profession, which I love dearly. So just living on my husband's one income with 2 children made it almost impossible for me to obtain complementary medicine. Even now, many forms of complementary medicine are out of reach financially for other people in constant pain. I think it's just wrong. I think our health care has to change. It was all I could do to try different things like massage, which also helped me, acupuncture, numerous other things. Right now, the best thing that I do is a walking program. I'm able to do, not a long distance, but at least I'm out there trying and I'm exercising. It's good for my legs and my back. Along the way, I also developed shingles 3 different times. So on top of my other pain, I now have post-traumatic neuralgia, which has been a real difficult thing to go through. But again, my medications help me. But I say to people, if there's a chance that you can go to a pain management clinic where you live, that really, really helped me, as well as, of course, the support groups and the things that I now do with the ACPA. So thank you very much.
Thank you, Marianne. Let's now move on to the discussion about resources. What sources of information do people with pain use to learn about their pain management? Tom, let's begin with you.
Sure. Just before we start, one thing I think that needs to be said is everybody's pain is different and everybody's reaction to medication is different. So when you see that when somebody with chronic pain sees somebody who's something is effective for, it doesn't necessarily mean that it's going to work for you. Okay, so having said that, to go on about sources of information. Like Penny, I've been in here for the long term. When I started out, word of mouth was the only source of information we had for dealing with pain. Doctors didn't know, we didn't know, we talked about it with friends. I said, well, if this doctor says he'll do this, that's where we all started. Now with the computers, we've got almost all the information in the world at our fingertips. However, people tend to go to Facebook or Google and think that the information they find is law and, right, 100% true. And although there is a lot of information out there, some of it's true, but the sources on computers are unreliable unless you do your own research. I found out that, Facebook is probably the worst thing in the world when it comes to general information. However, Facebook does have a group function where, say, I want to talk about people with back pain. I could actually communicate with people who are living with back pain, which is helpful. There's so many sources of information now. The ACPA has a great source. 2 studies I'm working on have websites that talk about pain. The information is out there. You just have to ask the right questions and research it on your own and find something that works for you. That's kind of a general brush, but that's it. So thank you.
Thanks, Tom. Let's move on to you, Penny.
Okay, and I'm going to speak from my role with the ACPA. So we get a lot of calls from people, and they're asking questions about medication and all of that. When it comes to medication, usually we'll tell them to go back to the prescribing physician or back to the pharmacist to get the most current information about the medications that they're asking about. You can go to the website on the FDA.gov and look at information, which is really the only place you should go. Sometimes you can go to the manufacturer's site to look at information on side effects or whatever. But when it comes to your health and the care, what we tell people is that they really need to talk to their healthcare provider and no one else. That's the only person that really has a sense of, your medical history, what you've done, what you've gone through. So that's the first place they should look. As Tom said, we do have a huge wealth of resources on our webpage. They've all been vetted. A lot of people, and when we do surveys, we always ask where they get their information. And many people say on the internet, from friends, from family. But as Tom said, there's so much misinformation out there on the internet that you really have to be careful about where you get your information. There's some really good sites out there, but there's some really bad sites. So again, You know, if you're asking about your own personal health, I think the best place to ask is your healthcare professional. And if you're asking about your medication, go ask your pharmacist. They're trained to help you and do that. So that's really all I have to say about that.
Thanks, Penny. Barbara?
Well, I think I'm learning a lot more here than I'm giving out information. My greatest resources were word of mouth and the internet. And I have been scammed so many times biting on information on the internet. I've gone to doctors who charge me exorbitant fees just to get into their office. Then their treatment consisted of giving me their vitamins, which they had, of course, all on their shelves right there for me to purchase. When I saw that, I would walk out. I've also ordered medications for fibromyalgia on the internet. Very expensive, none have worked, all false promises. So I have to say the internet is not the best place, like Penny said. And I think I'm going to have to join the American Chronic Pain Association. I think that sounds like an amazing place to find information. And I'm definitely going to do that. And I'm also going to spread that word around to several of my friends who are also in chronic pain. And just, that's about it.
Thanks, Barbara. Marianne, you want to go next?
Okay. As you can imagine, 35 years ago, when this happened to me, there was no internet. So I was left definitely to my own devices. I just basically heard what doctors would tell me, and back then fibromyalgia was still a mystery. And to some doctors, it even is today. So at least now, though, if you find the right, good website, as people said, a lot of them are just shams, but you are able to get some information at least. I speak from many years of experience. I just didn't know where to turn because nobody seemed to have answers for me. I have been told also that it was all in my head. Quit complaining. I saw a neurosurgeon once who said, well, what you have, I can't operate on you because the discs aren't herniated enough. Meanwhile, I was in terrible pain all the way down my leg, whatnot. He said to me, Marion, this is all in your head. You better get yourself together and get a life. And people looked at me and said, why should I keep complaining about constant pain? Why did I quit my job? I must be lazy. That's the thing that some of us hear who have the difficulty working because of pain. My self-worth and my esteem were just non-existent. I really went downhill and had a lot of depression. Once I had to be hospitalized for 2 weeks because of depression. I considered suicide, and it was just a bad time for me. I understand that the doctor's time with me is limited. So help me find out where I can get answers, as Penny said. Don't just tell me to learn to live with it. I wish more doctors knew about support groups, because for me, that was one of the biggest helps. Being in a room with other people who understood me and what it was like. The first time that happened to me, I couldn't believe it. I thought I was the only person in the world that this was happening to. I was so wrong. When I was able to get out and be in a support group, I learned so much more about it. As I said before, many cities have pain management clinics. Patients who are new to their plight don't know where to go, and support groups are another really good thing. I wish doctors would tell us about complementary medicine and other modalities. And I learned about meditation and how that changed my life for the better. Something I do every day. I'm able to relax, and that helps my stress level. Depression should be, I think, addressed by doctors. And if a patient says, I need help with depression, having a referral would be a great benefit to people like us, if we can afford it. Luckily, most medical health care now does allow for some kind of mental health treatment. Unfortunately, not enough. But I think that's very important too. So I have learned more because I went out and pursued it on my own. There are books to be read, there are groups to belong to, and they all can be helpful. But we, as people with pain, have to go out and usually find them on our own, because there's no way that these people are going to come to us and tell us about what we're going through. It is so individualized. We all have different kind of pain, different reasons. For myself, I have pain every single day. It never, ever goes away. I wake up, I go to sleep. It's there. And some days are definitely harder than others. But I know I've been doing it for so long now that I can continue. And I just do my best, pace myself, and move on. So thank you.
Thank you, Marianne. And can you each please, if you're not speaking, mute your line? I think we're getting a little bit of feedback. But up next, Kathy, please.
Yes, thank you so much. Oh, that's a powerful question. For me, I learned a lot of stuff on my own, and I had saved the ACPA, website on my computer, and at the time I had a computer you had to sit at, and it had a little bit of this and a little bit of that, so it wasn't like it was kind of put together for me, and it was so slow that I could only sit at the computer for about 15 minutes once I got booted up, and I put ACPA on my things that I wanted to go back later, and I did. It took me 7 years to be able to get back and really thoroughly look at that website, and I'm telling you, that was my first introduction on certain things you can do to manage, because like Marianne said, I have pain all the time, 24/7, 365, it doesn't ever totally go away, and a lot of people don't get that. They think that if you say you're in pain all the time, that's not true. So I learned a lot of stuff like that by going to ACPA. I had friends that had back pain before I did, so like I mentioned, one died and the other one was really helpful. Because she had been in pain for a long, long time prior to me getting injured. And she was the only person I had to talk to when I was at home by myself. I've been doing something to work to make money. I wasn't a child laborer, but, I would help neighbors out since I was 10 years old. So I was used to working. And in fact, when I went for Social Security, when I sat down, the man looked at me and I looked at him like, okay, let's don't even get started on, he started to insinuate something like, oh, you don't want to work or something like that. And I told him, look, the year my son graduated from high school and was going to college, I worked 2.5 jobs and took 9 units each, those 2 semesters, and had a 4.0. So no one has ever said I was lazy and didn't want to work. And so I used to get very offended when people would say, oh, you look so nice, though. Invisible pain is, like everybody said, everybody's pain is different, but invisible pain is the hardest to get acknowledged for because they can't see it, and they want to see everything. So that, to me, the support of being around other people that know what you're going through has saved me and helped me time and time again. I couldn't go to the pain management program at my hospital because it was a 6-week program and they wanted you to sit there for 8 hours, where I couldn't sit for an hour at that time, probably 30 minutes at max. I had to lay down and sit up. I couldn't just do either one for a very long time. And I don't have access to a lot of things. I'm not able to get in-home care, which I badly need. I have a friend that told me that. She said, I've been around you a lot, and I know in your home I can see the things that you can't do. But because I work so much, and they feel that the more money you make, the less services you get, you know, and that's one of my pet peeves is that I can't get in-home care. The only way I would be able to do it is if I got Medi-Cal, and I don't qualify. The only way I would qualify for Medi-Cal is if I use $5,000 worth of health care in a month that I had to pay out of my pocket. That's the only way. That doesn't make sense. Then you get people that work for 1 year in their lives, and they get everything, you know. And the people that work the most that are not on Medi-Cal, we get generic medicine. And the people that didn't work a lot, they get the name brand medication. So it's really a screwed up system. But anyway, the things that were helpful to me, my doctor that I used to have was very compassionate about pain. I read a lot of books and magazine articles, and I looked at some of the JAMAs. And I think just starting a support group helped me get out of myself, for one thing, you know, and like Maya Angelou would say, take a day to heal and then go out and heal somebody else, you know. And by sharing information with people, or we don't sit up in our groups and talk about pain, we talk about what you do not to be in pain. But just being in that room, like Marianne said, with people, they understand. And when I went to my doctor about fibromyalgia, I just walked in there and said, look, I have fibromyalgia. It's not in my head. It's in my body. And he said, he put his hands like really calmly, it's okay, Catherine. I know it's a real illness. So I was grateful for that, because people that I knew that had pain say, don't tell your doctor you think you have fibromyalgia, because they'll just think something is wrong with you. So anyway, those are the things I use, and people that I know that I have been close to that have pain. The only people that I really don't get along with are the orthopedics, because they feel that what they say is final and there's no open room for any other discussion. And I don't think that's right. And I think doctors need to be more sensitive and respect people's opinions when they say something. You know, it's true. It's what's going on with them. Their feelings need to be validated, you know, as a person with chronic pain. And Marianne brought up something about the depression. Depression goes with chronic pain, especially initially. That's what I find out from everyone I talk to. Now, this might sound a little off the charts, but all the people, the one factor I know when people have chronic pain, they have all said at one time or another that they wanted to die. Not that they wanted to kill themselves, but they just felt like they wanted to die, you know. So that's kind of how I know people have chronic pain. You're welcome.
Thanks, Kathy. Let's move on to the next question. What are the critical messages you feel that need to be communicated between healthcare providers and patients and families regarding pain care? Penny, do you want to go first?
Sure. I think one of the most important things is that it takes a team approach to help people live with pain. We talk about a person at ACPA like a car, except their car has 4 flat tires. This is a good analogy. And everyone's expectation is all we need is that one medication or one treatment, whatever it is. The problem is if it's in one of their tires, it may give them the 30 or 40% relief it's designed to do, but flat tires. The question is, what else do they need in order to get up and get going? And for every person, it's going to be different. It could be physical therapy, it could be counseling, it could be nutritional guidance, it could be a support group. It could be a wealth of things. When they get all 4 tires filled, it's their job to maintain their car. You don't take it back to the dealer and say, wash my one shoulder, fill her up. It's your job. If something goes wrong with the car, then we take it in for a checkup. So it's a combination of treatments and therapies with a person with pain at the center that's really going to get them up and get going. But we can't forget about families, because they play a critical role in how well someone's going to do. I did a survey of family members a long time ago, because I don't know what it's like to live with pain. I mean, with a person with pain, I know what it's like to live with pain. And so I interviewed them, and I thought I was talking to people with pain. There's only one difference between a family member and a person living with pain, and that is the family member doesn't feel the physical pain, but they experience all the same other emotions, the guilt, the confusion, the anger, the fear. They're experiencing it in the same way. So we really have to treat not only the person, but the family member. So, family groups are so important, and then the family also will help people maintain their wellness by encouraging them to continue their exercise or stress. I mean, it really is a family affair along with the healthcare provider. So as I said before, it needs to be a team approach, but that person with pain, he's got to be at the center, he or she. They're part of the treatment team. They're not a passive patient. They have to really become an active participant and say, what's my role in this? So it is a team approach. Everybody has to work together. So thank you.
Thanks, Penny. Barbara, you're next.
Firstly, the message that I'd like doctors to impart on the family is that fibromyalgia is real. We don't look sick. We are not sick. We are in chronic pain. And along with the chronic pain, for me, came horrible depression after about 10 years ago. I did think about suicide. Because of my faith, I didn't act upon it, but I did think about it quite a bit. So I think psychological counseling, at least for me, was a must. And I think counseling for families needs to be encouraged too, because it's really, really hard to keep supporting your loved ones who are in pain for such a long time. I was lucky. My family has stood by me, especially my husband of 52 years has been my rock. Without them, I wouldn't be here right now. I would have let the opioids take me away. I think support groups are a wonderful idea. I went to a few and just didn't like them. I didn't feel they were productive at all. So mostly I searched on the internet and found a couple that helped me a lot. I got suggestions from them on how to care for myself and also could voice my opinion like I couldn't voice it to my family. Your family gets tired of hearing you're in pain. It's a really, I just can't say how awful it is without help. But anyway, I'm just hoping talking to you people will give you some good suggestions on how to help people in chronic pain. Thank you.
Thanks, Barbara. Marianne, do you want to go next?
Unmute, maybe? Okay. I'm sorry, I didn't hear you say my name. I think when we go to our healthcare providers and doctors, sometimes they don't realize that those of us who are people with pain that have been living with it for many, many years are out of hope. We are desperate sometimes. We've tried everything that we've been told to try, and none of it is working. They're very quick to say, well, let me give you this, or let me try that, and they fluff us off. For a person who comes before them like me, I need to be respected. I need to be believed. When I tell you I know my body very, very well, don't tell me that I don't. Or don't say, well, you might try this and it might work for you. And, if I've already tried it, don't tell me to do something I know didn't work. And maybe I had terrible experiences or side effects. I know their time is limited, as I said before. But the big thing, too, that many people don't realize, and some of us have said this so far, when it happened to me, it just didn't affect me. My husband and my children, they were young. Their whole life was turned upside down. My husband had to become the worker all day, come home, cook, do the dishes, wash his clothes, try to clean the house while I lay in bed. It was so demeaning for me that I was at the point of my life where I couldn't have gotten up and did the laundry to save my life. I think our doctors need to know that they need to help us move through that and show encouragement. And other healthcare providers, as well as physical therapists and people that we are told to see. I have not ever been able to clean my house since 35 years ago. Finally, now I'm getting some help, and it's made a huge difference in my life. Being able to function again means everything to me. Another thing I think doctors and patients, should know that I'm lucky enough to live in the state of Pennsylvania, where 2 years ago, medical marijuana was made legal. I have been using it with great, great success. I realize it might not be for everyone, but it's something that's out there. And I wish some of the doctors might tell us about that. It's for people who don't know and are uneducated about it. There's a lot to be learned about it. So I'm grateful that I had that experience too. As I said, pain management clinics are just a lifesaver. Nowadays, they usually don't have in-house clinics. They're just go every day or a couple of days a week. I know people who have tried them, and they really are helpful. The only experience I would like to say is I have a woman in my support group right now who's 32 years old, has a 5-year-old, and just had a brand new baby. She has deep anxiety and insomnia, and her doctor took her off her opioid medication. So this to me is criminal. This woman is now suicidal. We in the group are watching her, and it's just absolutely horrendous. Nobody knows what to do for her. So they need to realize before you are taken off your opioids what this is going to do to your life. It's a very difficult situation, I know that. And as I said before, depression goes along with it. I've been there, 3 serious bouts of depression because I had good doctors and good medications that helped me out of it. But there are days when I still get down. I wouldn't say I am depressed anymore like I was then, but it's always there. And if I don't keep myself busy, keep active, it will come back, and I know that. So I try to do all I can to avoid it and still have a wonderful functioning life. So thank you.
Thanks, Marianne. Kathy, let's move on to you.
Yeah, for me, with my family has been the hardest. They're just kind of now getting it, and I have to say this culturally, and we're my family structures also, that I'm the one in my family that does everything. I'm not the oldest, but I take care of everything in my family, so I've been like the matriarch. And then when I got sick and down, my family members definitely didn't understand, what was going on with me. They were like, "What's wrong with you?" So I started sending them a lot of articles from ACPA and from the newsletter and things that help people. And I was on the verge of starting a family group for people because that's important for family members to be able to learn as much as they can about what you're going through. But my family it's taken them this long. I only have one child, but to really understand that, I do the best I can, but I'm not going to be able to probably do some of the things that I used to do. I'm the one that used to cook all the Thanksgiving dinners and keeping my family together. Now the younger people have picked that up. But what I wanted to say is with healthcare providers, I got treated differently because I worked in a hospital, when I wasn't, when I didn't have chronic pain. And I know I got treated differently. I get treated it took them a while to kind of balance that because I knew a lot of the doctors that I went to see prior to having chronic pain. So it was kind of hard for them and for me to switch our roles. You know, I'm your patient now, and I'm coming here for help. And they need to, a lot of them are getting better, but a lot of them are not knowledgeable. And I hate to add race, but I need to, because I think for me, I get looked at as African American, female, low income, and have health challenges, you know. And I know that from having, I have other friends of different races that are in pain, and I know they get better treatment than I do, and they get it faster than I do. So there's a cultural aspect, and I know when I was training to be a counselor, they had us learn how each culture functions, you know, so that you're aware of that, so you won't carry your own stuff and to process your own stuff if you need to about a particular race. You know, I don't know if doctors do that, but I think they should, because I have to really stick up for myself and be firm, you know, and because I worked at a hospital, I know a lot more than they think I know, you know, but still they need to be sensitive to what's going on with you and culturally sensitive also. I just happen to be very strong-willed, and I will speak up for myself. But a lot of people just get messed over. But I have read a lot of articles of the discrimination culturally to people with pain and versus people that don't, people of other cultures. That's what I wanted to say. Thank you.
Thank you, Kathy. Let's move on to you, Tom.
Paraphrase a list that the ACPA has developed for steps for dealing with chronic pain. One, people, both the doctors, and these apply to the doctors and the patients, the people with pain, as well as the families. One, there's usually no silver bullet to completely eliminate chronic pain. The first thing I hear from most people in support groups is, I want to be cured. People have to realize that they have to accept the pain and deal with the challenges. Two, people with chronic pain need to be actively involved in their healthcare process. We all need to know as much about the source of pain, medications we take, side effects of that medication, and what our limits are. Three, chronic pain curtails our abilities to move, work, think, and live. We need to be able to realize what our limits are and compare them to what we feel we need to do. We need to learn to set priorities to accomplish our plans. Four, knowing our limits is very hard because we all want to be like we used to be and do everything on our list or agenda. We need to be realistic, or realize that we need to set realistic goals for every aspect of life. Five, society is not very accepting of people dealing with chronic pain. We're often treated poorly because we don't have the same abilities as everyone else. Each of us needs to know that we have the basic right to be treated with respect. Six, dealing with chronic pain can easily cause an emotional outbreak. The worst part of having an emotional outbreak while dealing with chronic pain is it always makes the pain worse. Seven, stress seems to cause pain to increase, and pain causes stress to increase. People dealing with chronic pain need to learn simple relaxation exercises and use them when needed. Eight, one of the first things that happens when we have chronic pain is we stop exercising and moving so we don't aggravate the pain sources. Stopping seems to be a logical choice to make, but we need to keep moving to keep the muscles supple and blood flowing. Increased strength helps to deal with the pain. 9, realize that chronic pain does not have to become the center of our lives. We could choose to focus on our abilities, not on the disabilities while dealing with chronic pain. Each of us can have a normal life. It's just not always what we thought we would have before, or what we had before, or what we expected. 10, we all learn about ourselves and our chronic pain when we find out how to manage the pain. That knowledge is invaluable to others who are just starting to deal with their own pain. Each of us should reach out to others with our experiences and pain. Also, number 11, we all need to realize we're not alone in this battle. Thank you.
Thank you, Tom. So we have time for one final question. Question 5 is, if you had a magic wand, what would you change in the health system to improve care for people with pain? Barbara, let's begin with you.
I think the first thing on my list is to provide health care for people with pain, no matter what their income. That's the first thing I would change. Then I would change doctors' attitudes about marijuana. I think patients need to be given that option. I use marijuana also when the pain is unbearable and I want to bang my head against a wall. That is the only thing that stops it. I would want a new medication developed, non-opioid, that works. I would change doctors' attitudes at present who are withholding opioids from people who need it. I know at least 3 people in my life that have needed for short-term and long-term. And the one long-term had to detox tied to a hospital bed. It was the most disgusting treatment of a human being I've ever witnessed. I'm sorry, I get a little emotional right here. I'm very sorry. People are suffering needlessly now. And that opioids in a lot of cases are just the only option. I would also somehow create better pain care clinics like the one I'm going to that are innovative. It's not the same old thing. Here, try a spinal injection that may work for 3 months. Here, take a little bit of this medication that might work. Like I said, the clinic I am attending started me on the naltrexone, which has greatly limited my pain. They're very innovative. Like I said, I'm in a study of transcranial magnetic stimulation for pain, and it has reduced my pain. And they're looking at more and more things all the time. There are so many studies at this hospital that are treating all kinds of pain. And they also have preventive studies for people after surgery, so the pain doesn't have to go on for a year. They're trying to cut the recovery time quite short. And that's about it. Thank you so much.
Thank you, Barbara. Marianne, do you want to go next?
Sure. If I had my magic wand, I would try, even though I know I couldn't take the pain away from people, I would wish I could. I would make chronic pain and the care of it the utmost importance in physician training. Doctors are not taught a lot about chronic pain, and they need to be. All the ramifications and things it does to our lives. I feel like most doctors that I've seen have no idea about chronic pain. We are here in great numbers. There are millions of us. We didn't ask for this, yet it changes our lives forever. Believe us when we tell you this. Believe us if we say we're depressed or suicidal. I wish the treatment were there and more affordable for us. I also would, with my magic wand, give people the ability to get free information, how to meditate. All forms of complementary care as well as medical care would be available. I wish our medications for pain would be available and cost-effective for people who can't work. Many of us can't afford our medicines. Many of us deserve disability, and we can't get it. We have to jump through hoops. I know how hard it is because I finally got it. I had to fight hard and pay lawyers' fees and help me in my struggle for it. Because I haven't been able to work for 35 years, finally I was compensated for the work that I did in the past. It was able to help my family's income. I was greatly grateful for that. Finally, this may sound crazy, but if I had my magic wand, I wish every physician who takes care of people in constant pain to be able to live in my body for just one day. Feel it. See what it's like. I wish I could make them experience this. I think it would give them more compassion in dealing with us and want us to be the people we were meant to be. Thank you.
Thank you, Marianne. Kathy, would you like to go next?
Yes, that's fine. You know, I probably will say what other people have said. Some of the things is that they need to learn more, the doctors, the healthcare community, and our families. I know mine did, about chronic pain, and the doctors should listen to what we have to say. We know how we feel. You know, try to make the relationship between healthcare community and the patients a lot better. You know, and if I had a magic wand, I would cure pain. That's what I would do, because, like most of us said, we have a new normal. You know, we still can do stuff, but we're not the people that we used to be. You know, but I'm working toward that. You know, I just have to continue to do maintenance with all the things I know have worked. But I think the healthcare system needs to learn a lot, and if they don't know, people that can't get pain medication, a lot of them will just start buying street drugs, you know, to medicate that pain. And so that'll be a whole nother cycle of stuff that they'll have to deal with, you know, with crime and a lot of other things if they don't medicate people properly, you know. So we have a lot to, you know, I'm still learning, but the healthcare community could be a lot more helpful, and the social services community could be helpful so that people that can't do things for themselves in their home, they should be able to get the help. You know, I know people that get help 6 days a week and never worked a day, you know, and I worked for years, and I can't. That's one of my pet peeves right now, and I'm going to keep on saying it till somebody hears it and changes it. It's terrible, and I'm getting ready to write a letter to the governor, to Governor Newsom, about that, because it's unfair. It's totally unfair, and I have to pay out of my pocket, and I'm on a fixed income. So number one is we should be validated as people with pain. You know, don't say, oh, no, you don't have it. It took me a while to even get my church to understand that, because, you know, church just believes a lot of times, especially in my culture, that you go to God for everything. And I do. I go to church. I practice spirituality. I meditate. But I think God created help, too, so we could, you know, learn other ways to cope with our pain and stuff. If I can just say one more thing, we had a lady husband come to our group. She was a parent. She had about 3 little kids because he didn't believe her when she was telling him about her pain, and then he ended up with a back injury, and then he started to get it, you know, and that's unfortunate that people have to get it that way.
Thank you, Kathy.
Thank you. Mm-hmm.
Tom, you're up next.
Yeah, I really took it as this question as a, you know, pie in the sky. My biggest pet peeve about dealing with chronic pain and people who call themselves doctors and therapists and what have you is the communication is so poor. You have doctors who don't listen to the patients who don't listen to the doctor. Nobody seems to understand what the other person's saying. So my magic wand gig would be to create a device where the doctor could and the patient could feel what each other's feeling. If a doctor really could understand and appreciate the true pain of an individual, I think that the natural compassion that I hopes in mankind would come through, and a lot of the problems would be resolved. So my magic wand thing is a helmet that the doctor wears and a helmet that the patient wears so they can feel everything. Short and sweet, that's it. Thanks.
Great. Thanks, Tom. Penny, do you want to go?
Sure, and I think everything that everybody's already said is very valid, especially education for healthcare providers across the board for pain management. But I think it's also important, and if I had a magic wand, I would want to, in some way, have payers allow healthcare providers more time to spend with a patient to actually make that good assessment of what's wrong and what do they need. Because right now, they're all under the gun with this limited amount of time and seeing so many patients at a time that they're not paid for the time that they need to really make an assessment of the patient. So that would be one of my first things, is to give providers more time, get their time paid for, especially at the acute stage. We may actually prevent a lot of chronic pain if they only could figure out what's going on and make the appropriate diagnosis and treatment modalities. And the other thing is then is to be able to have better access to all of those alternative therapies, those things that will really get people up and get them moving and get them, help them be part of the treatment team, whether it's the physical therapy, it's the biofeedback, maybe it's acupuncture, all those things that are going to help them. So I think it's a combination of what everybody else said and what I've said, that really that's what we need to really improve pain care. And my last word is that anyone living with pain, we don't need to define it. We already know what it's like. But for all those who aren't living with pain, realize that people living with pain are trying to live the best quality of life as they can, and just believe the fact that they are in pain. I think that will help a lot. Thank you.
Thank you, Penny. And thank you so much to each of our panelists on the call this afternoon, Barbara, Marianne, Kathy, Tom, and Penny. Thank you so much for sharing your experiences and stories with us this afternoon. As a reminder, please, everyone on the call, you're invited to submit your written responses to today's discussion questions by clicking the link on the screen here. And also, a reminder that a recording of this event will be posted on the Action Collaborative website. Today's listening session is a part of a chronic pain series. We encourage all of you to join us for the next installment. The next listening session will specifically focus on the prescribing experience of clinicians caring for patients with chronic non-cancer pain. This session will be taking place on March 10th from 3:30 to 5:30 p.m. Eastern. You can register through the link on your screen here. I'd like to conclude the webinar by extending our special thanks to our webinar speakers and to all attendees for listening and participating. As a reminder, the opportunity to share your experience with chronic pain and contribute to today's discussion is available to you through the form linked on the screen.